Good morning to you out there and welcome to Galaxy today. Of course, today is June 20th and then of course it's a beautiful day out there. My name is Uche Onyekoroje and as usual, today is Wednesday where we'll be looking at health. But I got with me Joseph in the studio.
Hi everyone, it's so good to have you join us today in Galaxy today. We're talking health like Mucho just rightly mentioned, and today we'll be looking at toothaches and infections.
I mean, this almost look like a regular thing. We see kids having aches these days, and a whole lot of people get this misconception about toothaches and infections. Like, some people think when you take too much of chocolates or when you do too many sugary things, but I think it's more than that. What do you think?
And the interesting thing is, it's not just kids who have toothaches. You know, it's a respect of nobody. You could be a kid or even be an adult, and it affects everyone. I think it has to do with the negligence of some of us. What we throw in. It's often said that what we put into our mouth has a way of affecting the entire body, because they say the mouth is the gateway to the health of the entire body. And many people don't even know that when you have toothaches, it kind of like shuts your entire day, because when you're having excruciating pain, you literally cannot even function. And that's the importance of looking at this topic today and ensuring that we actually live by some of those tenets when it gets to do with oral health and hygiene.
Exactly. I think a whole lot of us take oral health very, very lightly. We tend to be quite ignorant about the kind of paste we use, the kind of toothbrushes we use, and of course the kind of what we eat. Some people don't even know that they have to brush twice a day. Some don't even know the benefit of having to gargle when you brush. I mean, all this would have a specialist who will be talking to us all the way from Ibadan, and of course would also link up with Abuja as we look at toothaches and infections. But before then, let's take a break. When we return, we'll go into the topic proper.
Galaxy Television is again recruiting fresh presenter trainees. Are you good looking, confident, have good command of English, and can speak eloquently? If yes, you might be the new face on television. All you need to do is simply send us your front, side, and rear view pictures of yourself with a 2-minute presentation in addition to your CV. Send to the email vacancy@galaxytvonline.com. Note, this advert is open for male and female. It will be a life-changing experience. Galaxy Television is again recruiting fresh presenter trainees. Are you good looking, confident, have good command of English, and can speak eloquently? If yes, you might be the new face on television. All you need to do is simply send us your front, side, and rear view pictures of yourself with a 2-minute presentation in addition to your CV. Send to the email vacancy@galaxytvonline.com. Note, this advert is open for male and female. It will be a life-changing experience.
Dear viewer, due to the Russia 2018 FIFA World Cup, there is now a slight change of broadcast of Galaxy Today, a flagship morning show. Galaxy Today will now run from 11 a.m. to midday while the Mondial lasts. We apologize any inconvenience this may cause our highly esteemed viewers. Galaxy Today will now be broadcast from 11 a.m. to midday while the World Cup lasts. Thank you. Galaxy Today, discussion issues as they thread.
Welcome back. Yes, it's Galaxy today, and of course we're looking at toothaches and infections. We just head us straight to Abuja, where we have a medical practitioner in person of Dr. Emeka Muma. Good morning, sir, and welcome to Galaxy today. Toothaches and infections, but before we go deep into causes and preventions, I'd like us to take us through what toothaches exactly is all about, as well as other tooth infections. Again, Dr. Doctor, we're looking at toothaches and infections. And before we go into causes and preventions of these toothaches and infections, I'd like you to take us through what exactly is toothache and what are other possible tooth infection one can have.
Good morning. Is the normal balance. Within the mouth, or what's called the pulp. This is the teeth. Usually, it can go from minimal infection to a fairly severe infection within a tooth, rather, which can develop to an abscess. So it varies from simple toothaches, which can be referred to as gingivitis or gum disease, or to a severe infection where a tooth actually has abscess or pus, as we know it, within the tooth itself. So there as such is an overwhelming disease within the oral cavity or the tooth pulp, where there's an infection, and often they're not is bacterial in nature.
Okay, doctor, I'd just like to know, you know the mouth is always busy. We always eat and throw or whatnot, into our mouth. We'd like to know really, at what stage should one be concerned about one's tooth? It could be a tooth, or it could even be a teeth. What stage really should we be going to see? Should we consider seeing the dentist to ensure that it doesn't degenerate into something really bad?
Yeah, I think you hit the nail right on the head. The mouth is an extremely busy part of our body, and we tend to utilize it as from the very moment we wake up. The exchanges of different objects within the food particles within the mouth. The mouth has been amazingly created, where there's saliva that helps to balance out the acidity of the oral cavity of the mouth. And this acidic nature of the saliva is actually to help keep a balance between the good bacteria and the bad bacteria. But because of, again, of our diet nowadays, where we tend to eat a lot of carbonated and sugary diet, we don't do the rightful thing, which is to brush at least a minimum of 2 to 3 times a day, and then also to floss. There is a higher tendency for these bacteria to grow. So the bad bacteria outgrow the good bacteria in the oral cavity, the mouth, that is, which can lead to an infection. Most infections are the key things to look out for infection are often fever, pain, redness, and anything that seems a little bit discomforting. Those are usually signs that there's need to have a healthcare professional sort of take a look down there, look in your mouth to determine if there's need to treat. Most infections will have the resounding pain and achy, feverish symptoms. And usually this can go from a simple treatment with antibiotics, or might need a procedure which can be done by an oral surgeon, a dentist, that is.
Like you did mention something about good and bad bacteria. I'm wondering what you mean by good and bad bacteria. When is the bacteria healthy? The bacteria is from the tooth. When are they healthy?
I'm sorry, what's the question? You had about bacteria?
You said that there are some good and bad bacteria when you were speaking earlier on. I'd like to know what bacteria is actually healthy for us.
Well, they actually, I don't know off the top of my head, but there's several type of bacteria we have in our mouth. A very common one actually is called Staph aureus, or a bit of E. coli, which is just a tiny bit, but we tend to have that more in our gut. But we can have a little bit of those sort of bacteria when we do what's called a mouth swab, and we take a swab of your mouth and we took it under the microscope, it's likely you can see some existing bacteria. Now, these are the good bacteria. What determines whether they're good or bad depends often on not on the quantity of them they have in the mouth. Falciparum, foliferous. They're the very type of bacteria that we have in our oral cavity. Just like how, interestingly, there are another strain of bacteria we have in, say, a dog's mouth. So when a dog bites you, it's not necessarily the bite itself that can hurt you. It's the saliva from the dog's bite, which contains a different variant of bacteria that can actually cause a severe infection in you, and hence why we talk about the rabies, which can be transmitted through a dog's bite. So most oral cavities actually contain several types of bacteria.
Let's go into causes. Can we talk about causes of toothaches and possible oral infections?
About oral infection?
Let's look at causes. What are the causes of toothaches and then other oral infections?
Yes, good question. Very good question. Like I said, nowadays, and again, I'm not a dentist, but obviously as a practitioner, a primary care practitioner, we do see quite several many people coming with toothaches and pains, and often referring to take some antibiotics or how to manage the pain. A lot of it is more of developing good dental hygiene, which is that if you don't brush as often as you should, and because we tend to eat a lot of sugar, highly carbonated food products without doing the needful, which is to brush almost 2 or 3 times a day and then to floss. This allows the festering of excessive bacteria. So the bad bacteria will outgrow the good bacteria, which will cause colonization within the oral cavity, and the growth of the bad bacteria will outgrow the good bacteria, and that's what can lead to a dental problem or infection. Again, like I mentioned, it can vary between just a tiny toothache to a dental abscess or an infection of the gum, which is called gingivitis.
All right, Doctor, we talked about dental hygiene. How often should we brush, really? Some people will tell you twice, some people will tell you thrice is fine. And at what times of the day, it's best to brush? Some people don't like brushing before they eat. Some would like brushing after they eat and when they go to bed. So are there times that are perfect for brushing?
Well, ideally, I think a good dentist would recommend brushing after every meal, but I don't know how realistic that is for most people. But I would recommend at least brushing minimum of at least twice a day. But if that's not possible, at least flossing every time you eat a meal. Using the toothpick doesn't really do justice to removing some of the food particles between our teeth. So my recommendation from a realistic point of view is, okay, if you can brush twice daily and then floss in between every meal, that'll be perfect.
In trying to give solutions to toothaches, some people might find that word as strange. How does flossing really work?
Okay. Well, flossing is usually when you take a little piece of string or piece of string and sort of pass it in between your teeth. What that does is it sort of releases the food particles to be from being stuck in between your dental your dental cavity, essentially. It's not very common. It's not very common in this part of the world, but it's something that I think we can all encourage ourselves. It's not actually very complicated. You just use a piece of string and try and pass it in between the cavities of your teeth. What it does essentially is just to release the particles, the food particles. A lot of times we go long periods without actually removing the extra particles in our teeth, and that's usually what leads to bacterial infections. I don't know how popular it is now, but I think it's something that we can be encouraged with proper dental hygiene. It's very much available.
So when it comes to treatment, now let's look at treatment, treating a toothache. I mean, I've got friends and maybe family members who would say one of the best ways to treat a decayed tooth, if there's a word like that, or probably an infectious tooth, is to remove it. Aside that, how else, how do you go about treating oral infection, or let's start with toothache itself? What are the things, what are the process, what's the procedure of treating a toothache?
I'm sorry, I lost the question. It's raining heavily here. Please repeat the question.
A lot of people feel that one of the ways, or I've had this notion from people where I've seen a couple of family members and friends who once they detect they have some kind of dental issues, especially if it's toothache, what they do is have to remove the tooth that is giving the issue. Now, what other ways, how do you treat a toothache and other oral infections?
What other ways can we treat, you said?
Other oral infections, how do we treat them?
Okay. What other ways can we treat oral infections besides just flossing and brushing? Is that the question? Well, I mean, besides just proper dental hygiene, essentially we can do the most basic, which is actually to drink more water. You know, drinking more water actually will help in removing some of those particles and balancing the sort of ecosystem within our oral cavity. That's a very simple one. Another thing is just again change the diet to eat less sugary carbonated products. Thirdly, which I found out recently, is actually chewing sticks. Chewing stick actually has a very, very natural component in it, which helps to kill bacteria in the mouth. It's been shown by science actually and confirmed that those who chew chewing stick can actually reduce the level of infection within their oral cavity. So there you go. Chewing stick actually has some medical and dental benefits. Those are what come to my head right now.
How about looking at oral infections? You know, I've heard people say that some particular food could cause an infection and some wouldn't cause
oral
it.
infection.
I hope you can hear me, doctor. I said that when it comes to oral infection and oral care, some people say that there are some kind of foods that can cause it and some wouldn't. But I almost look at it from the angle of care now. When it comes to taking care of your dental or your teeth, I'd like to know what kind of toothpaste is expected and what kind of bristles. I've heard people say that hard bristle works for me. Some say it's a softer bristle. But in taking care of one's dentistry or taking care of one's teeth, what must my toothpaste contain, and then what kind of bristle is best to be used?
Wow. I heard oral care, but again, I guess the rain, I can't hear the question very, very well. I apologize. Can you repeat the question again?
I said, in taking care of your oral dentition now, okay, so I like to know when it comes to using paste and bristles, what's the best bristle to be used? A whole lot of people think that the best is probably a hard toothbrush, and some think is a softer one. Putting into cognizance that you could have a very frail gums. So how do you go about taking care of your teeth? I mean, when it comes to using the right bristle and as well as using the right paste.
Okay, I'm sorry. The question I can't right here, but I guess you're referring to how can you use the right using the right sort of toothbrush or the the firmness of the toothbrush. Is that what you're referring to? Or versus cosmetic dent? All right. So essentially, dental infections, besides the use of a toothbrush, we need to know the type of toothbruch to use. There's this particular type level of strength, light, medium, strong, based on the way our dental features are. And a dentist will be very good in recommending the best of toothbrush to use. Likewise, the type of toothpaste to use. Ideally, I know that in most parts of the world, there's a recommendation to have excess fluoride in our toothpaste, which helps to strengthen our teeth. But I think in line with that question, I'd like to mention that medically, there are certain things that need to be looked out for when a certain individual presents with toothache, gum pain, swelling, bleeding from the mouth. There are certain medical conditions that actually could be, these can be the warning signs of. These are called autoimmune diseases, which can sometimes manifest with ulcers and swelling of the gums and toothache, as a matter of fact. So overall, oral health is important. It's not something for us to take all too lightly. There's need to have to get expert dental care, and even when you're not satisfied, get a medical practitioner as well to give their input when you're having recurrent issues of, like I said, bleeding from the mouth, swollen gums, ulcers within the mouth that you're not too sure about. It's good to go the extra length to get as much as medical input as possible. So in generality, oral health and infections are extremely very important to talk about when we talk about wellness in totality.
A lot of people who have plaque in their teeth, perhaps is that a warning sign that you're beginning to have, you will likely have toothache? What can be done? Is it reversible?
The issue of plaque is actually quite important. We as medical practitioners, we tend to often, when you see a dentist, plaques are extra growth within the mouth from formed infection. Removal of the plaque can be done by a dentist, but there's need to have the individual start on some antibiotics before the plaque is removed, because it's been shown again by science that this plaque, when removed, can actually travel into your bloodstream and can lead to certain infections which can end up in the heart. So, which are some what we call endocarditis. Okay, so there's need that before these plaques are removed, that you inform your dentist or your medical practitioner starts on some antibiotics to help prevent the plaque infection, which can lead to an infection of the heart, a form of endocarditis, essentially. So removal of plaques are done by the dentist, but there's need to think of ways to prevent the outcome of the plaque removal, which can lead to certain cardiac conditions.
People have devised different means of brushing their teeth. Some people will tell you they prefer to use charcoal. I don't know if you've heard about that, but people use charcoal really to clean their teeth. Would you recommend that? And again, for the toothpaste we use, obviously I'm not allowed to mention brands here. Are there specific ingredients we should watch out for in toothpaste to know if they're original or not?
Originality is an issue. We know the most popular brands in Nigeria, but and they usually will have the same content within them. But the primary recommendation from a medical point of view is to get that which is very rich in fluoride. Okay, so fluoride helps in strengthening our dental, our teeth, essentially, enamel. So any toothpaste that is rich in fluoride is an absolute plus. In developed parts of the world, they actually will have water that's enriched with fluoride to help strengthen bone health and strength. Because down the line, that's what will determine how quickly your teeth will decay. If you strengthen it early, then you prevent dental decay a lot earlier. So whichever brand you tend to use, but let it be rich in fluoride. That's my recommendation.
Case of pain, sometimes some people find it difficult to reach their dentist in time. Are there ways we can perhaps lessen the pains, pending when we get to meet with the dentist?
Yeah, a very good question. Very good question. Growing up, I know I believe they still exist. Those products that you can, when you have toothache, they'll put on a piece of cotton wool and apply to your teeth. It does work, but it's been shown over time now that this actually can cause to earlier decay of the teeth, because what it does is that it goes and stops adequate blood flow from going to your enamel of your teeth. So those are no longer recommended. They do have benefits because they will relieve. They have some anesthetic agents to help numb the pain. But over the long period of time, it's been shown that it could lead to earlier death of blood flow and blood supply to your teeth. So it's no longer in fashion. Simple analgesics, Panadol, paracetamol, usually will help if you take the right strength. But often than not, most of these toothaches can be extremely painful that you will need stronger medications, not just non-steroidals, but some that contain stronger products like the tramadols and co. To help with immediate relief. That would be my recommendation. But the sooner you get to the dentist, the sooner you can get the relief. Or the sooner you can get to a medical practitioner, the sooner you can get the necessary relief that you need.
Infections. Aside of the oral effect, with the oral disease or sickness you get, does it affect any other parts of the body? Where the infections are concerned here?
Well, I think a smile can affect your day. So I think that basically when we talk about dental hygiene, it's extremely important that we take care of our mouth, our dentition, because besides the overwhelming infection of the change in cosmetic or color, there's a condition called halitosis, which is essentially called bad breath. Bad breath is an indication that there's too much bacteria in your mouth that's overwhelming the good bacteria. My recommendation would be to do those things that I would recommend it. Drink more water, brush at least twice a day, floss, and if all things fail, see your dentist for proper advice on how to go about achieving the best oral health possible. Things to look out for again are excessive bleeding within the gum, ulcers or wounds within your dental cavity, swelling, discoloration, and pain that is not even that is still present even after you see the dentist. There could be some medical correlations that I forgot to mention, diabetes as well. Those could be signs of underlying immune suppression, and diabetes is very much one of those that to look out for.
Thank you so much, Doctor, for tuning in. That is all we can take from Audrey from Abuja. Thank you once again. And of course, we saw Galaxy today, like I always say, Wednesdays are meant for wealth. We just been speaking with Dr. Emeka Moma, a medical practitioner all the way from Abuja. Thank you so much, Doctor. We appreciate it. So for those of us at home, in case you want to be part of this program, remember that you can send an SMS to the number that will be displayed on the screen. We'll take a break. When we return, we'll go to our other outstation in Ibadan. Going away.
Dear viewer, due to the Russia 2018 FIFA World Cup, there is now a slight change of broadcast of Galaxy Today, a flagship morning show. Galaxy Today will now run from 11 a.m. to midday while the Mondial lasts. We apologize any inconvenience this may cause our highly esteemed viewers. Galaxy Today will now be broadcast from 11 a.m. to midday while the World Cup lasts. Thank you. Galaxy Today, discussion issues as they thread. Galaxy Television requires the services of broadcast engineers. Applicants should possess a first degree HND in broadcast engineering or any related disciplines, special skills, ability to operate and maintain broadcast equipment for video production, broadcast, satellite transmission and interactive media, setting up and monitoring of audiovisual links between units in different locations, installing and testing of new facilities and equipment in post-production suites, analyzing and repairing of technical faults of equipment and systems, setting up and operating equipment and transmission links during outside broadcast production operation, up to date with changes in technology and ability to investigate new systems and techniques. If yes, send your application and CV to vacancy@galaxytvonline.com.
Galaxy Television is again recruiting fresh presenter trainees. Are you good looking, confident, have good command of English, and can speak eloquently? If yes, you might be the new face on television. All you need to do is simply send us your front, side, and rear view pictures of yourself with a 2-minute presentation in addition to your CV. Send to the email vacancy@galaxytvonline.com. Note, this advert is open for male and female. It will be a life-changing experience.
Dear viewer, due to the Russia 2018 FIFA World Cup, there is now a slight change of broadcast of Galaxy Today, a flagship morning show. Galaxy Today will now run from 11 a.m. to midday while the Mondial lasts. We apologize any inconvenience this may cause our highly esteemed viewers. Galaxy Today will now be broadcast from 11 a.m. to midday while the World Cup lasts. Thank you. Galaxy Today, discussion issues as they thread.
Nigel Ray, join Emmy Fly as he takes you on a fun-filled, exciting adventure into the studio.
I get to love the leaf for Shomolu.
And watch talented producers and artists behind your favorite hits do what they do best.
I use the Nexus on Fruity Loops 12.
Nigerians, you can see it, this is how we make music.
Get to know them.
Because I like to be free. I like to be able to walk on the road with my palm slippers and people will not be like, hey.
See talented rappers go head to head and watch them show what they've got in 60 seconds.
I forgot to introduce myself. My name is Emo. Buried on the game like Jack Sparrow. Dressed like Commando. Spray up like Rambo. It ain't my fault, homie. I'm street to my bone marrow.
And you guys are watching Nigeria
With my main man, Emmy Fly.
Inspiring and very entertaining. Tune in every Saturday, exclusive to Galaxy TV.
Welcome back. It's to Galaxy Today, and of course, it's the health edition where we're looking at toothaches and infections. Before we went on break, we were at Abuja where we spoke to Dr. Emeka Moma, a medical practitioner. Now we'll be going to our outstation in Ibadan where we have Dr. Francis Fagbole, a senior registrar of community dentistry from University College Hospital in Ibadan. Good morning, Dr. Francis Fagbole. It's good to have you right here on Galaxy today.
Thank you very much, our viewers at home. Once again, my name is Francis Fagbole. I'm a specialist community dentist, University College Hospital, Ibadan. To start with, I have to commend Galaxy Television for a program such as this.
I'd like you to take it from there. When we talk toothaches and we talk oral infections, what exactly are we talking about? What exactly are we talking about?
Yeah. Toothache is basically pain from the tooth. Not just the tooth, but the surrounding structures. So the first question we'll ask is pain good or not? Do we consider pain to be a good thing or a bad thing? Well, I like to let us know that pain in itself is not bad. As a matter of fact, we can call pain our friend because it helps to point us to an impending danger that can happen to our mouth, and in this case, our tooth. Because when you have some problems with your teeth or the surrounding structures. Now, when I mention surrounding structure, we are talking about the gum, we are talking about the bone that even holds the tooth in place. So when you are having problems with them, then it manifests as one of the ways is by having pain. So the reason for this is such that we can take action immediately and not wait like many of us do. I must also inform us that there are different types of pain. So when we say I have toothache, you can have 10 different people saying they have toothache. But the type of pain, the character of that pain is different. For toothache specifically, it can be a sharp pain. It can be a throbbing pain. It can be a dull pain. Now, the truth is that for dentists who have been trained, they know that this different type of pain will mean different types of problems that can be happening to that person. For example, if you say I have a sharp pain, now it's telling me most likely probably a tooth is fractured. Can it be that the enamel on that tooth has been eroded off such that it's now very sensitive to cold water or stuff like that? If it's a throbbing pain, some people have pain that disturbs them on their sleep. You have such that is just giving this very severe ones. Now that may tell us that, oh, this pain is probably got to the pulp. I think Dr. Emeka mentioned something about pulp the other time. So really, toothache is a symptom, a manifestation of a problem that is happening to our tooth or the surrounding structure. And even though many times it is when we have this pain that we will now start looking for help, what we are preaching these days is that you are not even supposed to wait till you have pain before you present to your dentist, and this is where the issue of general checkup comes in. So in a nutshell, I think that should answer us, should give the answer to what toothache is from this side of the country. Thank you very much.
I'd like us to also look at other oral infections. Aside of toothache, what other oral infections do we have? If they have names, can you tell us, please? I'd like us to also look at other oral infections.
Thank you very much. Again, we should know that toothache is not an infection. Toothache is not a disease. I emphasize, toothache is the symptom of a problem. So what can the problems be? The simple one is you have a hole in your tooth, which you call caries. Now, if you have a carious lesion, we should know that the tooth, the shape of the tooth that we see, inside that tooth, this is the way I like to put it, inside a tooth is the life of that tooth, and that is where we have the pulp chamber. Now, any form of irritation to that life of the tooth gives us pain, because inside the nerve endings that will make that happen. So when you have a hole in the tooth, when the hole starts getting deeper and deeper, then it means it's getting closer to the pulp, the life of that tooth, then you start having pain. If you have fractured tooth, meaning a broken tooth, probably you are hitting, we just finished the salad break, you are hitting bone, and the bone cracked your tooth, you are going to have pain. That is because there's now an opening that has gotten to the life of the tooth. Remember the pulp. If you have periodontal problem, and that is with what we say gum problems, the Yoruba people say akoko and the likes. What that means is that there's an infection of the gum. The gum holds the tooth in place. Now, when that happens too, it can elicit pain. I must say generally that infections manifest very different ways. One of the cardinal signs of infection is pain. So, dental caries, gum problems, fractured teeth, and the likes will manifest as pain. What we should do is don't sit at home. Don't wait until you start having pain before you present to your doctor, before you go to see your dentist. Because even though, like I mentioned earlier, pain is good, it points us to the fact that there's an impending danger. Again, by the time you visit the dentist with your pain, it may just tell you, oh, at this rate, you may have to lose that tooth. So, pain is a symptom of the problems in the mouth, which I've mentioned, but it's not good for us to wait before we have the pain, before we visit the dentist. Thank you very much. Problems in the mouth, which I've mentioned.
Yourself and Dr. Moma, spoke about the needs or the importance of brushing all the time to ensure that your teeth is spick and span and you avoid all kinds of infections or whatnot. Now let's talk about toothbrushes now. Are there ways we can actually store our toothbrushes? Because I read recently in the research where certain toothbrushes, some fecal samples, particles rather, were found in those toothbrushes. And that's because of the culture we've come to embrace of always keeping our toothbrushes in the bathroom. So are there ways we can store our toothbrushes?
Thank you very much. Now, yes, you asked earlier about toothbrushing, brushes, and the like. So I would like to touch on them together. Brushing should be, like Dr. Emeka said, we say after every meal. Of course, we know that that is almost not possible. So you brush at the very least 2 times daily. In the morning and the last thing before you go to bed. But even when you eat elsewhere in the afternoon and co, even if you are not brushing, the last thing you can rinse your mouth. Well, you can either spit it out or take it in. The food came from your mouth anyway. So after every meal, we must at the very least clean our mouth, brushing or at least rinsing the mouth. Now, so what do we use to brush? Toothbrushes, what is important about toothbrush is the bristle. For adults, we talk about medium textured bristle. That is, not too soft, not too hard. For the soft ones, those are for children, babies, essentially. And people talked about hard bristle toothbrush. I'll advise that we don't use them, except, of course, if it's recommended for us, because we know that it has its untoward effects on the gum and even the tooth itself. About storing our toothbrush, well, I think I should just mention what the major problem is. When you brush and there's fluid on it after brushing, of course it's going to be wet. And if you close that up, you know that it's giving a wet medium where bacteria, microorganisms can thrive. Such environment, after a while, maybe that was what the study you said you read, where they can start seeing some microorganisms growing, because a wet medium is a good culture for microorganisms to thrive. So essentially what you need is that make sure that your toothbrush is not wet at any point in time, at least can dry as quickly as possible after you finish brushing. So in terms of storage, of course, it has to be stored where it's clean and where microorganisms will not be able to thrive. I don't like an idea of straitjacketing people into the ideal and say, okay, if you don't put it inside a cup and hold it up, then it's not the answer. Let's understand the principle behind it. You don't want the bristle of your toothbrush to be perpetually wet because it serves as a culture medium for microorganisms to dry. Ensure that you keep your toothbrush dry and clean, and I think we'll be fine. If you permit me, I can also mention one or two other things that has been said on cleaning. And I'll quickly go to using chewing stick. Like Dr. Emeka mentioned to us, yes, we have some chewing sticks that are even medicinal. However, I like to sound a note of caution because we worked here at the community unit department, headed by, at that time, the study by Professor Taiwo, that there's this one they call ataori, this yellowish form that some people use as chewing stick. We found out that you had fluoride in it, which is very important. If you also notice, it is not very, very hard, like you have for some other chewing stick that are sold commonly. So the reason is that it's easier for you to chew it and it becomes very fluffy. Now, when it's very fluffy, it can simulate the medium textured toothbrush that I mentioned earlier. And with that, if you use it to clean, it's likely that it won't cause problems to your gums and the likes. But this is where the challenge comes, is how do you use a toothbrush, a chewing stick, to clean inside the teeth? Most times when we use chewing stick, we just clean the outside, the facial part that we can see. But how do you go here? How do you go there? Those corners of the mouth, the chewing stick is not malleable enough to access those places. So at the end of the day, you find out that you use chewing stick and you just clean areas that are accessible. Those areas that are not accessible get accumulated with plaques and calculus and now cause problem. So if you must use chewing stick, this is what I think you can do. Learn and use the regular toothbrush for brushing. After that, I think you can make chewing stick the jara on top, if you permit me. So basically, about cleaning the mouth, I think I should quickly mention that. Thank you very much.
Because we're having questions and comments from people across. But before then, I'd like you to quickly, maybe in 10, 15 seconds, tell us when exactly we're to visit a dentist. When I mean visit now, when exactly are we to have regular dental checkup?
Start by saying that immediately we have our small babies, you should start taking them to the dentist for review. But generally for everybody, we say 6 months. Every 6 months, that is twice a year. Now what you do is go to the dentist, just look into my mouth. They will help to identify if there are impending danger somewhere. You see, many times we have holes in our mouth, but we don't know, in our teeth rather, because they are not yet giving us pain. But if you go to the dentist at the right time, he looks into the mouth and he says that, oh, there's a hole possibly developing here. This is what we can do to quickly prevent any problem from it. And that is going to be done. So we advocate twice a year. But it also depends on the relationship we have with your dentist. There are some people that need to visit their dentist at least every 3 months, depending on what they found in their mouth. So to answer the question very briefly, twice a year generally, but specific relationship with your dentist will determine essentially when your appointment should be. Thank you.
Some of these questions that are being passed down here, I'll take 2 to 3 questions, then you can answer briefly so that people can get informed. This one is Sunday from Ijebode. He said, I feel so much pain in my teeth. What do I do? And then another one says, my name is Ahmed. I have a hole inside my teeth, and it just makes my mouth smell. What do I do? I'll take one more. And then this one said, there is a video on social media that if a wall gecko licks your toothbrush and you use it, it can lead to death. Can we quickly run through these 3 questions before we take the next, please?
Okay. I think that's from Ahmed, talking about having hole in your tooth and having halitosis, that is bad breath. Well, it's understandable because when you have a hole in your tooth, that means that food particles get stuck in it. You can't clean them off, and after a while, microorganism works on them, and just like you have in the regular gutter, or it starts smelling. Quickly to add to that of the issue of halitosis. So the most common cause of halitosis is dirt in our mouth. Like I said, dirt in the hole in your mouth, or simply because we are not cleaning very well. About wall gecko, the toothbrush leading to dirt, I think let's just allow it that is the social media. Let's put it that way. But because as for science, something important had to lead to what? Really, for me, that's just for social media. But you asked earlier about, is it possible for problems in the teeth or the mouth to cause problems for the body? Definitely, definitely. I don't want to scare you, but I will tell you very clearly that I've had patients who had died and the problem started from a hole in their tooth. This discussion is talking about toothache and infection. The point is that if there's a hole in your tooth, we call it pathophysiology or pathogenesis. It goes from that tooth to the pulp. From the pulp, it goes into the bone. And if your immune system is down, and that's why Dr. Emeka mentioned people with diabetes mellitus, not just that, then the body cannot mount enough immune system against that infection, and it can just spiral down and you find out that the person loses his or her life. That will not be a portion. But for it not to be a portion, what do you have to do? You need to have regular checkup. Somebody spoke about having pain, and I'm surprised that we are still sending text message that you are having pain. We should be visiting our dentist. We should go and make complaints. In fact, what we are saying now is that you shouldn't even wait till you have pain. Now you have pain, please, I advise. And this is the common mistake we have. Now your friend tells you, oh, I had toothache the last time. This was what the doctor did to me. Oh, I had toothache the last time. I was told to go and use this kind of drug. Please, we should be very careful. You know, I mentioned at the beginning, there are different types of pain. So don't think that your own what is causing your pain is the same with the other person. Somebody having a sharp pain is different from somebody having a throbbing pain. So please, someone having pain, go visit your dentist. Hole in your tooth and you're having halitosis from it, that hole needs to be either filled or something else done to it. And I'm sure you are going to need general cleaning. And about the issue of wall gecko, please let's leave it to the social media. Thank you.
Wrap up with these questions because we are really pressed for time. This one said, is mouth odor or plaque tooth infection? In answer, and what is the solution to mouth odor? And this one also said, my name is Joy. I brush twice daily, but when I wake up in the morning, my mouth still feels smelly a bit. He said, is there any cost to that? I mean, she's asking if having to brush twice a day could also still give mouth odor, which I think is true. And this one, I'm sure he wasn't here when we started the program. He said, what exactly is the cause of infection and toothache? This is Ibrahim from Egbeda in Lagos. Can you do this in 1 second, please, because we are out of time, sir?
In a second means that the most common cause of halitosis is because of dirt, food particles in our mouth. And plaque and calculus hosts bacteria, microorganism, and the produces what comes from them is majorly the cause of the odor that we get from our mouth. I'm sure the person that wakes up and finds out that the mouth is smelly is most likely because brushing wasn't the last thing the person did before he or she slept. If you brush the last thing and you brush very well, you know, there's a difference between brushing and brushing well. So please, I think, because of our time, I cannot explain. There's different causes of a mouth odor. As a matter of fact, if somebody is sick, if the kind of diet you take can also affect it. But because of our time, I will advise that if you have issues with mouth odor, please visit your dentist, explain, and what is causing yours will be identified, and the appropriate solution is going to be given. our major problem is that we don't know how to clean our mouth. Yes, we have emphasized brushing morning and night, but brushing the right way. Time may not permit us to teach us now. Please know we have to visit our dentist and get the best of treatment. And of course,
to leave now, but this really must go. This one said, I brush with water and salt. Is it healthy? Please, yes or no, doctor, so we can leave. Brush with yes or no, doctor, so we can leave. Brush with
Okay, I'm sorry, just give me 15 seconds because that is not a yes or no answer question. What is important with brushing? We mentioned about toothpaste. Please, is that fluoride is important. People talk about, they advertise different types of toothpaste. Plus knows that what is important is fluoride. So you bring that to salt and water. Is fluoride in salt and water? With what are you using? I just quickly advise. I think the person should get a fluoride-containing toothpaste to brush with. Warm salt water is good for your gums. Maybe occasionally you can just gargle with it. It's fine for your gums. But please, when you want to brush your mouth, brush with fluoride-containing toothpaste and, of course, a toothbrush. Thank you.
As much as we can take, we cannot entertain more questions, but do believe that by this time next week we'll go on health again. You can send in more questions. Before we leave, we just want to say a big thanks to Dr. Emeka Moma from Abuja, a medical practitioner who took us all through the program, and of course Dr. Francis Fagbele, who is a senior registrar community dentistry from University College Hospital from Ibadan. Thank you so much. And to you out there who joined the program, we want to say a big thanks. Let's do this same time again tomorrow. I'm Uche Onyekulujay.